Thank you so much. Well, let's start with our land acknowledgement before we dive into our topic for today. New Mexico Alliance of Health Councils humbly recognizes and acknowledges we are on unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, Apache Nations, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities while strengthening and respecting relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nations' sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes and nations who are still here today. And today, 1st of December, happy December, everyone. We're going to focus on giving you all an update on our advocacy efforts, how you can engage, what we're expecting in this upcoming legislative session, some very critical information around capital outlay as a potential funding source, and also touching on sort of the differences between advocacy and lobbying.
Yeah. And Priscilla will be joining us momentarily. She was on the road, and so she's calling in as we speak.
Okay, so we'll take this moment to welcome all of our 21 attendees as we wait for Priscilla to join. We see Diana. Good, welcome, Diana. Barry just joined as well. Geraldine, Antonio, NMHC's tribal liaison. Hi, Geraldine. Jose. So just thought I give a quick shout out to, and Rochelle, welcome everyone. So Priscilla should be joining us shortly. There she is. And we see you, Anthony, Yepa. Priscilla, we saw you there for a little bit, if you can hear us.
Can you hear me okay?
Yes, we can hear you now, my friend.
Okay. My apologies. Oh my goodness. Good thing you called me, Susan.
Yes.
But that's kind of how my weeks have been. So my apologies.
Quite all right. So everybody, I specifically asked to introduce Priscilla. I've known Priscilla for over 20 years, and her amazing work that she's done with the Grant County Health Council, but she also wears many, many, many hats, including executive director of the Southwest Council of Governments. And in her various roles, not only is she just an incredible advocate for health councils, as well as many, many other things, but she's also a master at knowing the capital outlay system. I've seen her work just flourish over many, many years, helping municipalities and counties get lots and lots of money, because it's a very technical process. And so thank you, Priscilla, for being here. I think you are probably one of the most informed people who know capital outlay and knowing health councils. And so I'm going to turn it over to you, my friend. And thank you so much for joining us today.
And if you would just mind telling me, Susan, how many we have on the call today, that would be really helpful without me having to scroll through everything.
Oh, sure. We have about 23 people on the call right now.
Okay, wonderful. Okay, well, thank you for the invite. And again, thank you for for being so patient, and my apologies for being late, and accommodating me today. So a little bit about capital outlay. I think the first thing that I want to talk about capital outlay is that capital outlay is really intended for city and county governments It's either city, county, or state agency. So you have to be a political subdivision in order to receive funds. So that can also include mutual domestics, it can include school districts. And so just know that. I think that one of the things we need to keep in mind when it comes to health council work is that health councils are really either fall under a local government or they fall under the nonprofit status. And there are ways around that. But what makes that unique in New Mexico is that you have to be compliant with the anti-donation clause. And when you're a nonprofit, that sometimes hinders the opportunity to receive funding from the state due to the anti-donation clause. So a little brief overview of a capital outlay. Capital outlay are dollars that are based on the amount of revenues that come into the state of New Mexico. And in the last couple of years, we've had quite a bit of surplus of capital outlay dollars. Typically, from a legislator's request, we average, and I think, let me just go back to last year's allocation. A legislator that's a senator probably averages about 4.1 million, and that's a lot because there is money at the state level. On the representative side, you can probably reduce that by 1 million. They always get 1 million less just because there are more representatives on the House side than there are on the Senate side. So you have two different forms of capital outlay. One is what we call severance tax bonds. And severance tax bonds are bonds that are actually sold once the awards are made. And then what happens there is they typically do bond sales for those capital outlay awards, which happen either in June or December. But we are seeing some variations to that. We're seeing that sometimes now September. So that's kind of just like a general rule. Then we also have capital outlay dollars that are general fund dollars, and those just basically come from the general fund from the state of New Mexico. So just be aware of that. Some of the uses of capital outlay include, it could be anything from purchases to installation to furnishings to designing, planning, construction, purchase of vehicles. You cannot use capital outlay for the purposes of operational use. So really important to remember that. And I'll talk about this a little more in just a minute. The only funds that you can use for operational purposes are really what we call House Bill 2 junior funds. There was a period of time there where they were not utilizing House Bill 2 junior monies for any kind of purpose. And those are funds that you could utilize for operational use. And for operational use, and then the only way you could actually get those funds would be to partner up with the local government that you were providing a program or a service in exchange for that. So that's how those House Bill 2 junior funds. So capital outlay in a lot of ways, we have to use what I would say very basic language. You don't want to be too broad in the language for capital outlay, because what does happen is that if you're too specific in the language, then you're bound to that, because that language is going to be utilized in the bill, right? Then once the bill is signed by the governor, you cannot deviate that. You can't deviate from that bill. And the only way you can do that is that you would have to go back into the next legislative session and do what we call a reauthorization to do that. So some typical purchases that I see utilizing capital outlay include purchase of vehicles, because you need admin vehicles or you need equipment to run your operations. In some cases, it could be furnishings because you need to equip your office to do things. It could also include things where you have to do renovations, construct facilities, water systems, wastewater systems, sidewalks. So there's a whole piece to that. There's also what we call information technology is another piece where we can use the money for. And again, these are very specific based to a disbursement rule that Department of Finance and Administration puts out in order to ensure that when the bill is drafted and approved, that those are the uses of those funds. So usually there really is no what we call a minimal request, although from a logistical standpoint and implementation piece, you really don't see any legislative request that's under 50,000. We have to be cognizant of how much local legislators get so that we can ensure that we are not going overboard in our request, because they also have to cover not only your region, but other parts of other counties and various districts. So usually what I recommend to my local governments is kind of put it in the purview. If you have a legislator that receives 4.1 million, then let's be realistic about what we can ask for. And that is about 200,000, maybe 300,000. If you have an area in which the legislators are collaborating together, then one of the things you can do is have the legislators work collaboratively to where each one might put in 200 apiece, and then maybe you get enough money to do a $600,000 project. I can tell you yesterday, we had our legislative forum yesterday. Some of the things I learned from that legislative forum yesterday is that there's a big move at the state level to ensure that any request that is being submitted can actually be spent. Because right now there's $5 billion of unspent capital outlay. Those capital outlay agreements have terms based on the type of project, and it varies anywhere from 2 years to 4 years. A little bit of inside information. So all of these project managers that actually implement these capital outlay projects, each project manager is averaging about 200 to 300 projects per person. So you can see the level of magnitude of what they're having to do with, number one, doing the pay requests, the grant agreements, and all of those pieces. Where I find things very helpful, being a health council member, as well as partnering up with local governments, is that let's just take a couple of scenarios, and then I think I'll open it up for questions, Susan, because I think sometimes you get more out of the question and answer piece. Is that, let's say you're receiving funding as a county government for the health council, and now you want to be able to do renovations for a facility in which you're going to be housed, because that's where you're going to have your staffing. So the county can then apply for a $200,000 request, do renovations to the facility, and now that becomes your public space to carry out the functions of the health council. So that would be how you would go through that portion if it was a capital expenditure. If it's a health council seeking funding for the purposes of creating or needing operational money, then your opportunity is to have a conversation with the local legislator, because I'm going to tell you, they are not going to know whether they're going to have any operational money to provide to any nonprofit group until the session starts. House Bill 2 junior money is controversial in many ways. And so I can tell you publicly that this governor does not appreciate the House Bill 2 junior money. So sometimes they have to think of creative ways to put in a bill to be able to make it work to satisfy requirements. So an example I could give you is Grant County received $80,000 of House Bill 2 junior money that they contracted out to be able to do all those initiatives to supplement the $15,000 they get from the Department of Health to provide those resources and help move forward some of the priorities around the community needs, right? So that can be extremely helpful because then that provides you a year's worth of funding. What we have to remember about House Bill 2 junior monies is that is one-time funding. And that is that when I say one time, that means that once you're awarded, it's only good for 1 year. So if you're awarded July 1 of 2023, then it would expire June 30th of 2024. And then if you wanted to try to get money for the following year, then it'd be a constant effort on your part to ensure that if there's House Bill 2 junior monies available, that you continue to work with legislators and really show them the outcomes of your efforts and what you've been able to do with the utilization of those funds. So I'm going to stop there because that's like the quick and dirty overview, and I'd be happy to share, Susan, with you a more detailed PowerPoint that I have that I made for local governments so that you can distribute. That gives a heck of a lot more detail about the specifics about capital outlay. But I think in this context, I think you're really wanting to look more about how they can get some additional operational funds.
Yeah, and thank you, Priscilla. We would love to, and we would make sure that that PowerPoint is available to folks. We're going to open it up for questions. Does anybody have questions for Priscilla?
I love to be challenged.
Did you all, Priscilla, that was great. Oh my God, I've been doing this ICIP for decades. But
Okay.
the way you presented it is it doesn't take 3 days to understand. But I have a question
Sure.
regarding the ICIP process. Did you
Okay.
provide a link on that
I
to
did
show
not, but
folks,
I
you know, the process?
no, to me, in
Just
my
to show the
opinion,
process of.
yeah, the ICIP is a very complicated piece. So let me just give you a quick explanation to that. So the Infrastructure Capital Improvement Plan is really a planning tool. There's a lot of confusion around the ICIP, thinking that that is a funding tool. It is not a funding tool. The reason it was developed under Governor Johnson, was to ensure that local governments were planning, properly planning whatever they were going to be requesting from the legislature. Because what was happening is that you had community members that were circumventing the local government process and then going around, and then they were getting funding for things that they didn't even know anything about or had even requested. So that became a real issue. So the thing that's important about ICIP, and this is something we strive for in everything that I do, is that if you're going to be requesting a capital outlay request, I can tell you internally at the state, it should be in the top 3 priorities of the local government's capital improvement plan. Now, when you do the training for ICIP itself, it says top 5. If you're trying to secure funding from other funding sources that are competitive grants, it should be in the top 10, or it should be in the priority year. But most people think that if you develop an ICIP, that means you've already submitted the request. That is not how it works at all. So people miss out on opportunities because they think that's the way it works. Does that help?
Yes, I just wanted the folks to understand that that's a process, because they have to have public hearings. The city or the municipality
Yes.
have to have.
This is a tip I'm going to give you, because I used to have this gentleman, because I've been doing this for a long time. But I take this as a valuable tip, and I say this to all the people that are residents or that are looking for money. If you never take the time to go to the public hearings and tell them what your need is, they're not going to know what your need is. And so this gentleman, he would keep going to all the public hearings. He goes, I don't need any money right now, but one day I will. And so he would always say, in this case, might be health councils, right? We need money for programs because, we're needing to do more of this to help these community needs. Or it could be something that the health council is promoting. And let's say that it's something to have like a homeless shelter, or maybe one of the requests that we had yesterday, which I know health councils are very actively involved in, is getting those systems that they can put in schools bathrooms so that they can detect when students are vaping. Some of us are not in that field, but those are all things that can be funded, right, to the local government or to the school district to alleviate a health risk, right? And so those are things that I think about. And so those are things that can be included in the capital improvement plan because they are specific to what the need is. If it's a school district, it should be included in the facilities master plan. That's what's different between local government and school districts. So those are all things that I think are important to the development of your project.
We have another question from Barry, but before I get to Barry, Anthony had a quick question in chat. Can the $5 billion unspent capital outlay be reprogrammed to be spent to meet intended projects?
So I think that is one of the intents. That is one of the things that we're being told right now is they're looking at those projects to see why the money isn't being spent. Is it because it's a supply issue? Is it because the cost of the project has doubled? What are the reasons? So we have to be careful about determining what the reasons are for that, because we don't want to take away a project that was a critical need and maybe didn't have enough money, which is no fault of the community because the costs have changed, or maybe they don't have a contractor to do it. So I think there's always that possibility, but if that happens, then what happens is that something that the community has been working on is now lost, and there's been a lot of investment from the community. So I think it's a possibility. It wouldn't go back to what I would call programming dollars. It would go back to those dollars specifically for constructing projects or supplying equipment.
And Barry, you have your hand up.
Oops. Sorry about that. Having some problems. Good morning, everyone. Priscilla, I'm from Harding County, the Harding County Health Council. And my
Yes, how are you?
question is,
Good to see you again.
good. My question to you is, we're split between Roy and Mosquero, and we alternate our monthly meetings back and forth. But when we're here in Roy, we have to rent space to hold our meetings. So my question is, can we use the capital outlay to build ourselves a conference? And we have two wheelchair accessible vans, one for Roy and one for Mosquero. So my question is, can we use the capital outlay money to build ourselves conference room / garages in Roy and Mosquero?
My response to that is yes, as long as you have the support of the local elected officials, because ultimately they're the ones that are going to have to submit the capital outlay request.
Okay, good. And we do. The Harding County Commission is all behind us. So.
And sometimes here's just a thought. What we've done in some of the communities, sometimes school districts, for example, may have some extra portable buildings, and those portable buildings need to be moved to a location for utilization. So, for example, the local government can then get an estimate to actually move a modular building, take it off the hands of the public education department or the school district, and then move it to a location that now can be used for other things. We've done quite a bit of that in our area, because what we don't like to see is those kinds of buildings that are just dormant and not being utilized. We've used them for juvenile justice services. We used them for health council. We've used them for a number of various things. The Montessori schools, we can use them for community centers in unincorporated areas. And that's a challenge, right? Because when you start talking about your smaller and rural frontier communities, their revenues are limited, right? Their financial capacity is much less. But if you can think about those creative ways in which you could, a local government, and approach them, could you ask for $100,000 to move this portable building that's been donated to us for this purpose? Then you got a deal, right? So those are things that you can use your creativity to partner up with the local government. And if you're not having conversations with your local government or not participating in those meetings or including them, then that's where sometimes we miss the boat, right? Because we don't know how those all interconnect.
Oh, yeah. Oh, yeah, I see that. And that's a distinct possibility in Mosquero, because right now
Mhm.
they're building an entirely brand new school. So that's but in Roy, it's not, but in Mosquero, it's a good possibility. So I'll look into that.
I
Wonderful.
think
If you,
we've seen a lot of that, and they use them for classrooms and community centers, and and it's a fraction of the cost.
if you would be good enough to put your email in chat for me,
I
if I
will.
have any more questions, I'll contact you.
Yes, you can do that at any point. And Susan, if you wouldn't mind doing that for me, since I'm in the car, just put my email address and my contact information.
I sure can.
And I'd be happy to share any thoughts and ideas about any project, just because I've been doing it for so long.
Well, thank you very, very much. You've been a big help. And thank
You're
you,
welcome.
Susan, for being the middleman.
Yeah, absolutely. Any other questions that we have for Priscilla? And if you think of questions, feel free to contact the Alliance. We'll pass your questions on to Priscilla, get those answered. Capital outlay is a complex thing to kind of navigate through, but we have a friend who we can call on who can maybe help give us some guidance on that. So thank you so much, Priscilla.
And Susan, I would just offer as well, maybe at some future point where we can really take examples of different projects and I could share them and kind of show what things we could done right specifically around health council. Be happy to do that as well, to discuss that. And then I will send you an email with the PowerPoint so you can share with everyone.
that sounds great.
We
Okay.
toss that in the garbage when we pass. Okay, thank you.
Thank you. And I'll put Priscilla's email in the chat in just a minute, but I am going to turn it back over to Val.
Thank you, Susan, and thank you, Priscilla, for making time. Such critical information and yet another avenue, right, for identifying resources for health councils, general operating or infrastructure, so on and so forth. Once again, my name is Valeria Larcon. I'm the executive director here at the New Mexico Alliance, working on in service of our county and tribal health councils. Yet again, during this upcoming legislative session, very, very close collaboration with our internal team, Susan, Rebecca, Geraldine, Antonio, our tribal liaison, and many others. I thought it would be good to kind of start with the intention of our advocacy efforts. I think that's really important, and also give you a quick little tour as to the advocacy avenues and tools that we have available in support of our health councils, advocating for adequate funding in this upcoming session. And then I'm going to give you an overview of all the various avenues in our advocacy efforts and also fundraising. So when you visit our website at nmhealthcouncils.org and you click on the advocacy page, you're going to quickly find some advocacy collateral, 1-page summary, 7-page summary about the critical function of health councils in our advocacy efforts. Internally with the team and our health councils and public health partners, we're also generating a lot of energy around our letters of support. And who that gets submitted to is Legislative Finance Committee, the Office of the Governor, Director Sali at LFC. All of this with the intention to engage, educate, and enlist their support, right? And so on behalf of Health Councils for adequate funding, this most recent effort with letters of support, we were able to gather 260 signatures that included public health partners, health councils, community members, legislators, both on the House side, Senate side, LFC, other interim committees. So that really was very, very encouraging. And we have an upcoming deadline again, December 8th. So if you haven't had the opportunity to engage with this specific advocacy effort, we highly recommend and invite you to please do engage and share it with in all of your circles, professional, family, community, in your specific circles of connections. So this is really a call to action for our executive branch and legislators to support this funding bill for health councils. We also have a printout letter of support that you can have available for your health council meetings, for any educational events that you're hosting, to enlist signatures from community members, and some advocacy tools here for all of us as a collective across the state, because we are stronger together in calling, emailing, and writing to our elected officials. Of course, our governor, Governor Michelle Lujan Grisham, to enlist her support for adequate funding for health councils, Legislative Finance Committee in this interim session, and then, of course, members of Senate Finance and members of House Appropriations. So as you all know, advocacy in the legislative process is most pivotal at this time in the interim session leading up to the actual session at the beginning of the year. And as you may know, this upcoming session is a short session of 30 days. So we need all of our collective voices, all of our unified efforts here, voicing the message of how important, critical, pivotal it is to invest in our county and tribal health councils as a very instrumental, integral public health mechanism here in New Mexico. We also have very clear talking points as to what is it that we're asking when we're talking about adequate funding for health councils. And of course, at an average of $143,000 per health council based on their capacity and operational needs. And of course, funding for a 501c3 to continue to support health councils with technical assistance, peer learning, training, advocacy efforts, so on and so forth. And we do have plenty of context here as to the language, the toolkits, right? How you want to convey that message, because the more we do this in a unified manner and in numbers, the stronger our advocacy efforts will be. We also have been able to curate a PSA advocacy video, again, to engage, educate, and enlist the support of lawmakers and our executive branch in funding health councils. This has been, I want to say, a labor of love from the NMHC team, also with the support of a filmmaker from our Santa Fe Community College, Kyla Van Buren, and also the support of our board members and Senator Stefanix, who I'm going to talk a little bit more about her role here in the advocacy update. Susan, do we have time for a 3-minute, or shall we share this link with folks?
We have time for the 3 minutes.
Okay, I think this is important. Let's see if it plays. I'm going to take myself off of video. And I want to just say too that we have a radio show called To Your Health on 103.7 FM here in Santa Fe. We will, it's also, the radio interviews are also aired as podcasts, and we're seeking to amplify the voices of health councils as part of our advocacy. Here, I'll stop.
So we can't hear the video.
Here, Rebecca, I'm taking my headphones off.
I think what's really great about health councils is they serve as the liaison between community and state agencies, or community and elected officials or leadership. You know, whatever it is that we're trying to relay information to regarding community health and public health, that's what health councils are.
What we try to do is provide resources, provide information, direct folks to the things that they need. And it's not for us to decide what they need, but we are out there every day and we're talking to folks and we are building these relationships.
We have many problems that are not being addressed and that are not seen because they're in rural areas. So when people come to the food banks, when they come to secondhand clothing shops, when they come to walk-in clinics, they are presenting with some needs. And those are the needs that health councils can bring to the attention of elected officials.
Currently, health councils per county and tribal are currently being funded at $15,333. So when I think about public health infrastructure, when I think about the critical foundational role that health councils play in delivering public health, in conducting the community health-based assessments, conducting the community health improvement plans, implementing strategies, collaborating with partners in the public sector to deliver services to their local community members. To me, that seems a very obvious operational infrastructure to invest in. And currently in New Mexico, we're not doing that.
The issue that we know about health councils is that, and it's county and tribal health councils, that some of the cities and counties have the means to invest in our health councils, and some rely totally on state funds. So we, as a state legislature and as the executive branch, we need to step up and we need to make sure that the appropriate amount of funding goes into our health councils so they can plan for all the people in our state.
Take this opportunity to invest in our local communities, advance health equity by investing in our local health councils. This is the most obvious mechanism by which to streamline resources, programming, services, collaborations at the local level so that every New Mexican, 2.11 million New Mexicans, have access. Access is at the heart of ensuring equity.
Okay, my friends. So just that, as I mentioned before, this was a labor of love and something that we are utilizing as a digital media advocacy collateral as we're engaging with the public, amplifying the call to action for the state of New Mexico to invest in our local county and tribal health councils. There's also some editorials that have been issued, some toolkits. So there's a lot of resources here on the NMHC advocacy webpage. Susan, I'm watching the clock here. I'm going to give a quick overview of our various advocacy and fundraising efforts on behalf of our health councils. So this kind of gives you an overview of our multi-pronged strategy. Number one, starting obviously working with DOH to include funding requests in their state agency budget proposal. This avenue is no longer a viable avenue. They've submitted their proposal. They have various competing priorities. And so currently that budget request remains at $15,333 per health council. We are going to be working with DOH to see what kind of federal grant support we can get, to see what kind of funding dollars are out there through our federal partners. The second strategy, which is at the heart of our advocacy efforts in engaging, educating, and enlisting lawmakers and the governor, is a funding bill at $6.6 million for health councils, as I mentioned. Of course, exploring opportunities, funding opportunities via capital outlay. Thank you again, Priscilla, for the concise, thorough, in-depth overview of what's possible there. and of course, the potential of junior funds. And that remains, my understanding, is up in the air. We're working closely in support of, I should say, Representative Anthony Allison, Representative Liz Thompson, Senator Liz Stefanik, and Representative Johnson, who are championing the funding bill. There's an open request already. They're going to be pre-filing that funding bill come June 2nd. And we've been actively engaging support from both House and Senate side to usher that bill through introduction on the House, on the Senate, inclusion in HB 2. And as I've been advised by Lieutenant Governor on multiple occasions, you know, the enlistment opportunity here is the governor, right? Enlisting her support in approving that funding bill for our health councils is critical. And so when I say, you know, we're stronger together, please join our advocacy efforts. We need to hear the voices of our health councils. We want to amplify the voices of our health councils, the critical work that you do, and also really paint the picture, right? What does New Mexico look like without our health councils? A day without our health councils. Representative Allison recently gave an analogy of, imagine Albuquerque without Loveless, right? So that's a significant impact of the critical work you all do. And so that is the messaging that we're seeking to also amplify in our advocacy efforts and also quantify. Here's the impact of our health councils. The third strategy has been in the philanthropy area, of course, engaging with philanthropy partners in the state, national level, high-end individual donors. I just want to say that on these two strategies, the pushback that we continuously get is that, oh my God, Val, yes, the work of health councils is impressive, is critical, is needed. But because this is a function of public health, state mandated, it really is the responsibility of the government to invest in this statewide public health mechanism called county and tribal health councils. So that's been a significant pushback and ongoing theme from these two strategies. However, I think we have made some enlistment that we will be revisiting at the beginning of the year through the legislation to see what happens through this upcoming session. I think there may be some opportunity for what I am calling a lifeline, unrestricted operating dollars for our health councils and potentially NMHC. Moving on to the fifth strategy in the private sector, same messaging, my friends, but I think that there is an opportunity with corporate sponsorship, care management organizations, and exploring opportunities with higher ed, UNM, for example. So that's an ongoing effort, even though, you know, it's that same theme of it is a responsibility of the government. We have been working, building relationships with tribal government, Pueblo and nations as well. And recently, this month, we were had a big win with the support of the All Pueblo Council of Governors, who have signed a resolution in support of adequate funding for health councils, which has been addressed to and submitted to the governor, to legislative finance. And thank you, Geraldine Antonio, our tribal liaison, for being so integral in building these relationships and achieving this significant win. And we will continue that relationship building with our tribal government. A big win this week, my friends, is the endorsement of the funding bill, $6.6 million for health councils, county and tribal, from Indian Affairs Committee. We presented to them on Wednesday, presented to them again yesterday. They had some additional questions, and they voted to endorse this in their recommendations for the upcoming legislation. So that was another big support for our health councils, and exploring other with Indian Affairs. Opioid funds, as we know, seventh strategy, as we know, New Mexico has received a significant number of settlements in the millions, close to $1 billion now, for opioid, addressing opioid crises. As we know, health councils are addressing opioid substance abuse, fentanyl, so on and so forth at the local level with, you know, education, prevention, intervention, direct services. So we're in the works of meeting with Attorney General office, the Deputy Secretary there, to talk about how opioid funds are being distributed at the county level and the critical work health councils are doing in that sphere of public health crises, and perhaps funding dollars to invest in our health councils. The same sort of theme here with the alcohol harms. Oh my gosh, I can never remember the acronym. Susan, can you help me? Alcohol Harms Alleviation Coalition that's being supported by Senator Ferrari and other public health leaders. And so we've met with them. There's so much synergy with the work that they're doing, that the health councils are doing. So, you know, including a funding request in their proposal for health councils as well. Other state agencies that we're also exploring, obviously synergies with the work that health councils do is HSD with the rural primary care, to see if there's funding there that could help with general operating infrastructure, programming, capacity with and for our health councils. 10th strategy, of course, federal grants, congressional grants. We have upcoming meetings with Congressman Worth, Senator Ben Lujan to explore congressional funding. Also, the potential of a no-cost extension with CDC, but that's, you know, there's nothing concrete around that, but that's worth exploring as well. And many other efforts, but these are sort of like the very the 9 that strategies that we are actively exploring and enlisting support for our health councils moving into next year. You know, best case scenario, we get a funding bill approved for our health councils at 6.6 million. Worst case scenario, then we've got these other strategies to circle back to and see what could be possible for a lifeline for unrestricted funding for our health council, so that we can continue for another year or multiple years to come. Let me pause there. I know I just went over a lot. If there are any questions, feedback, Geraldine too, I know you've been deeply involved with me on all these fronts, or reflections or new ideas that you may have.
I do have a quick question, Valeria. Who are your sponsors for the bill?
Yes, Representative Anthony Allison, Representative Liz Thompson, Representative Don Johnson, and Senator Liz Stefanik.
Okay, so I can tell you on one of the legislative interim committee meetings, Gail Armstrong, she came unglued in one of the finance committee meetings because she has been advocating for the health councils for years. And she just says, like, I don't understand, you know, when you're all gonna listen, you know, that we have to have these in the most rural and frontier communities. So I just want to challenge. I would also, if I was you, reach out to Shanna Sasser, who is our rural and equity ombudsman for the state of New Mexico, and make her aware of your requests. Because she is critical in helping us bring monies to some of the most rural and frontier communities. And this is where we need the funds the most, right? Because we don't have those services. And I think it's important that they are made aware. And one of the things that I've always done, and sometimes we have to do a better job of just tooting our own horns, right? But it takes time to document the data. And I'll give you an example. I got some grant funding and I just started to just jot down whether I had a hand in it, whether I did it all together, whether I guided anybody or helped to put narrative or a letter of support. That totals from January 1 to the present, a total of $61 million in the region. So when you can show that leverage for every dollar invested in you and what the number is coming out based on leverage, then I think that's also a great indicator to show why it's important. And I can tell you the last thing I'll say is that, and I've made this very clear to elected officials, if we would have had those health councils fully funded during this pandemic, that would have meant saving lives. It would have changed everything from that perspective. And I think you need to use that because we're realizing that that's not ever going to go away.
Absolutely, Priscilla, to your point, and internally the team, we've been working closely with health councils to collect some in real time, quantitative, direct impact at the local level so that we can also quantify it based on, priorities at that statewide level. And to your point about COVID and the reach of health councils, particularly in those rural communities, which is 60% of New Mexico, right? Rural, frontier, border, tribal communities. We reached 16 to 17% of that population thanks to the CDC funding, WK Kellogg with emergency response. And it's very interesting because as we've been speaking to legislators, it just seems like the posture too is sort of over COVID. And the reality is that COVID is still impacting communities, and the fact that another worldwide or statewide public health crises, could happen, and to have that mechanism of public health, stabilized, fortified, invested in to be able to respond promptly. It's something that the state really needs to consider. And it's something that we still, even with that sort of pushback of we don't want to hear you talk about COVID anymore, and the reach the health councils had during COVID, we're still tooting the horn of, yes, it is important to talk about this because 60% of New Mexico does live in very rural areas. So thank you, Priscilla, and I'll circle back with you so I can connect with Shanna too. Shanna. Back to you, Susan. I think noticing the time.
Yeah, so we have 3 minutes left, so I have to be real quick since we don't have any further questions, or we might. But I really want to focus in on the next 3 months. As Val said, one of the key strategies is getting increased funding for health councils through the legislature. A question that comes up is advocacy versus lobbying. You can go out and you can talk to your elected officials, tell them about your health council, tell them who you are, tell them about the great work you're doing. That is advocating, that is informing and educating. So please, we highly encourage you that make your elected officials aware of your health councils and the wonderful work you're doing. When you start getting into lobbying is once we get a bill number and you are asking an elected official to vote in favor of a bill, that is when you start crossing that line into lobbying. So in the next 3 months, once the session starts in mid-January, we will have a bill by our wonderful bill sponsors with a bill number. It'll be filed January 2nd. You'll start seeing notices from the Alliance. If you can, nonprofits can do some level of lobbying, but what you have to do is you cannot lobby for a bill number with your CDC Kellogg funding. So if you're being paid on your time from CDC Kellogg, you cannot be lobbying. You can still educate and inform, but you cannot lobby. So be sure if you're going up there and you're saying, Senator or Representative, please vote for House Bill, whatever it is going to be, or Senate Bill, whatever it's going to be, make sure your time is either you're volunteering your time and you're doing it as a private citizen, or maybe you're being paid, but it's unrestricted funding. Some health councils do have unrestricted funding which means it's not restricting you. It doesn't have any restrictions on it. And if you have any questions about that, let us know, because we are asking health councils once the session starts, if you can, please give public comment during the committee hearings that the bill will be assigned to. Please sign letters of support, which specifically mention the bill. And of course, during Public Health Day, or at the statewide meeting, if you're visiting with your elected officials and asking them to vote in favor of a bill, that would also be lobbying. So I'll leave it at that. We're right at 1 o'clock. Any final questions or comments? Staff will stay on for a couple more minutes if anybody has any questions.
Is there a way to say it that it's not lobbying, such as please fully fund health councils without
Yes.
naming the bill?
Yes, and that's what we're doing in our current letter of support. As you can see, it's informational. We're telling the governor and the chairs of chair and co-chair of Legislative Finance Committee that this is what health councils do. What we feel we need in order for them to be adequately funded is $143 per health council, if at all possible. That's just informational. So yes, Diana, you can do that.
Thank you.
Any other questions? And Enrique, you were asking, yes, I believe what we're looking at in that $6.6 million is 143,000 per health council, correct, Val? Right, Val? Yeah. And,
Yeah, you just said $143, and I was
thank you.
assuming.
Thank you, Enrique, for catching that. Yes, 143,000.
143 is closer to what we get now.
Well, thank you, everyone, and visit our website, nmhealthcouncils.org. Go to the advocacy page, and you'll have a lot of tools there to help you in your advocacy efforts.
Thank you, everyone. So great to be here with all of you, and looking forward to making this legislative session count for our health councils. Thank you.
Hi, everyone.
Bye, thank you.